All right, everyone, welcome back. Hope you all enjoyed your lunch. We're ready to kick off the second half of the day for the Disability Aging Summit. And we have two presenters here to talk about the Medicaid home-based and community-based waivers. We have Kara Thrasher Livingston, who has worked in the field of disability supports and human services in Alaska since 1994. Her experience includes direct support, program design, advocacy, education, and government service. She has lifelong family experience as a sister of a brother who experiences intellectual disability, and she also has two young adult sons who have autism. She currently works for the Senior and Disability Services, DHSS, state of Alaska, supervising a team that provides training for community, long-term services, and supports. And then Heather is the manager of the Intellectual and Developmental Disabilities Unit at Senior and Disability Services. She is a lifelong Alaskan who has a passion for increasing the quality and clarity of services for individuals who receive waiver services. Heather has been with SDS in the IDD unit for 10 years. And prior to coming to SDS, she worked in the field providing direct care, case management, and care coordination to individuals who experience DD, MH, and co-occurring disorders. She has a master's in clinical psychology from the University of Alaska and a workforce credential in leadership, education, and neurodevelopment related disabilities. There's more about Kara and Heather in the program that we have here, but I just wanted to take a minute to introduce them and turn it over to them for their presentation.
Yeah, let's see. We'll see how it goes. Okay, can folks hear us okay? All right, we'll probably just take turns in front of the mic. Great. Thanks for having us here today. We're excited to talk about Medicaid home and community-based waivers, give us some basic information and a little bit about the current changes that are underway or being thought about, and take your questions and hopefully provide some answers. If we're unable to answer a question, don't worry, because we like to research it and get back with you. So that might happen too. And we always have, you can always email us a question, and I have an email available at the end of the presentation. That's pretty easy to remember. So we take questions anytime, not just at this time. So Heather and I are going to talk with you today about waivers and basics. And we're going to also, Heather's going to explain our intellectual. Go ahead, advance it, please. Take one more. See, I told you I'd get confused. It's all good. We're going to talk about what Medicaid is, what's a waiver, how are people eligible for them, what do waiver services do, what services are in which waiver, and what other help is there. And if you could advance it, please. And that's just an introduction. We can go past that one. Already did that one. What is Medicaid? All right, please go one more slide. Okay. Medicaid is basically health insurance. It's health insurance for low-income Alaskans. You may be familiar with family Medicaid, known as Denali Care, or sometimes people remember Denali Kid Care. There's lots of other types of Medicaid. Medicaid has many configurations, so people become eligible for it different ways. Long-term care Medicaid is what we're going to be talking about. It's sort of a special corner of overarching Medicaid, and it governs special services for frail elders and special services for people who have a permanent disability, both children and adults. And next slide, please. All right. About Medicaid, it's interesting to know a few details. All states make a state plan for their Medicaid, and Medicaid is overseen in every state by CMS, Centers for Medicare and Medicaid Services. That's the office that approves our state plan and the state plans of any state. CMS reimburses the state for a percentage of the cost of the services done under their waivers or other Medicaid programs. In Alaska, we're reimbursed 50% for waiver services. Alaska does have 5 waivers. Other states may run more or less, or even none. Not every state has the waiver. However, even if they don't have a waiver, all states have to have long-term services and supports, which is what LTSS stands for. They have to have some options for people who need this care throughout their lifespan. Okay, next slide. So what is a waiver? Next slide, please. So the word waiver is sort of an unusual word to talk about supports for people or help for people. It is short for the home and community-based waiver for frail elders, adults, and children with physical and/or developmental disability. A waiver is there to help people who need the same care as that given in a facility. And a facility would be like a nursing home or a facility that's put together to serve people with developmental disability. A person needs the same kind of care, but they can choose this type of care in their home and/or community instead of entering a facility to get the care. So the federal requirement to use Medicaid to reside in the facility is waived, and that's why we use the word waiver. Alaska does not have a facility for people with intellectual developmental disability. So most of our care is done in the home and community. Next slide, please. Okay. And a waiver. Who does what? A care coordinator will write the support plan. The person will choose their goals or outcomes of each service. Everybody who does the service, meaning a provider, they need to be enrolled with Medicaid, which means they sign up to do that service. They bill Medicaid for that service. And when they bill, it's interesting because the service is approved in units and they use procedure codes, just like you might see on a statement of benefits that you get from a regular insurance company. They might say, well, these procedures were done and this is how much it cost, this is how much we paid, that type of thing. Because it's a health insurance model. So that's basically running under health insurance. Next slide, please. So what led to waivers? Basically, everything that is in the history of waivers starts with advocacy, which is why we love to talk about it. It came about as a result of people wanting to live the life they choose with the supports they direct, just like our current statement says, vision statement. So advocacy started it. There's lots of legislation that led to it, and I'm not prepared to give you a list of all the legislation about community care, but I can pick out 2 big ones that are good to know about. One of them is the ADA, Americans with Disabilities Act, and the other one is called Olmstead Decision, and they both work together to create waivers and long-term services and supports. And this came under the guidance of our federal government to say that supports have to be there throughout the lifespan and the supports must work together. Next slide, please. So this is just a basic slide about the ADA, Americans with Disabilities Act, an extremely important law, which became a law in 1990. It is a civil rights law. It prohibits discrimination against people with disabilities in all areas of public life. work, school, transportation, public and private spaces and places, and communications, modes of communication as well. The purpose of the law is to make sure that people who experience disability have the same rights and opportunities as everyone else. There are 5 main sections of the ADA, and there's lots of language about any of them. Employment, government services and places, public accommodations and businesses that are open to the public that are run by private entities, telecommunications, and then other miscellaneous provisions. Next slide, please. And then let's think about the Olmsted decision for a minute. The Olmsted decision is important. The story of Olmsted, which is what we call the case, it started with 2 women, Lois Curtis and Elaine Wilson, who resided in a facility. They had developmental disabilities. They resided in a facility in the state of Georgia. And they went through their program there, their treatment, their therapeutic treatment. And their people that oversaw their treatment stated that they were ready to move to a community-based program. However, they were told they needed to stay in the institution, and they did end up staying there, each for several years after their treatment was done. And they filed suit under the Americans with Disabilities Act for release from this hospital, which was the facility that they were in. Next slide, please. And so the Olmsted decision on June 22nd, 1999, it was a Supreme Court case. It was decided that unjustified segregation of people with disabilities constituted discrimination in violation of the ADA. So it made it so that people couldn't access regular spaces, places, and being in a neighborhood and things like that. So it was held to be against the ADA. And states were told that we must build supports for people to choose. And there was language in there about people wanting to participate in community care and people's needs being able to be met in community care. And then a little bit about the journey that at the time it took each state to build community resources for people. So it didn't start from fully made, like we have a lot of supports today, but at that time there wasn't a lot, but we needed wording and language to say that it was required. Okay. Next slide, please. The Supreme Court's Olmsted decision, it basically stated that institutional placement of people who want to and are desiring to reside in the community and direct their life was segregating and isolating to people. It diminished everyday life activities for people and was not conducive of a regular life and a full life for people, including having family relations and social contacts and work, being economically independent, being educated and being part of your neighborhood and your culture. So it was very segregating. Next slide. So what do waivers do? Waivers are services that help with everyday life and learning and development in the home and community. Outside of 2 of the services, which are nursing care and 1 being therapy by a professional, these also are services that a person might need for everyday life. Outside of that, they're not medical care, but they are determined or decided on around medical necessity because it's the health insurance model. Waiver services can't replace any other support the person has or duplicate themselves or each other. Like a person might have a medical provider or a family that helps them or school that's helping them if they're school age, that type of thing. It doesn't replace those things, but it adds supports where they're needed. And one of the services that a person must have in a waiver is a care coordinator. So that's the one required service in a waiver. Okay. Next slide, please. Alaska's 5 waivers. And here we have a lot of letters and acronyms. So that's how it goes in this world. IDD, people with intellectual and developmental disability, any age. ISW, individualized supports waiver, any age. APDD, adults with physical and developmental disability, age 21 and over. CCMC, children with complex medical conditions, birth through the young person's 21st year of age. And ALI, Alaskans living independently, age 21 and over. And so this is just a list where I'm trying to show you that it comes from this bigger legislation about the lifespan, offering supports through the lifespan. Alaska's pretty comprehensive with its 5 waivers. All right, next slide. So what this slide talks about is level of care, and this is how we talk about eligibility and finding out what kind of care a person needs to match a person with a waiver that fits their needs, that also fits the structure of that particular waiver. And so we have 2 waivers that have letters that are ICFIID, which stands for Intermediate Care Facility for somebody with an individual with an intellectual disability. So the IDD and ISW waivers have that level of care that a person would have an assessment to determine that they need that kind of care. For the other 3 waivers, it is a nursing facility level of care. And so they have an assessment that tells whether they need the same kind of care as that which is provided in a nursing facility. So to keep it easy in your mind, just think that there are 2 separate levels of care. And it's just like a door that opens the waiver to that person. All right, so I spelled out ICFIID, the next one. Go ahead, next slide. Thank you. Intermediate Care Facility for individuals with IDD. Most of the care, again, is done by what we call unlicensed staff outside of the ones that are the waiver services that are nursing services or done by a skilled professional. Most of the waiver services are done by people who don't have a medical license to do them. They're very knowledgeable people and trained and experts, but not a licensed staff member. Okay, next slide. For the nursing facility level of care, this is when a person needs the same kind of care as that given in a nursing facility. Most of the waiver services are intermediate care outside of the ones that require it to be a licensed nurse to do them. And this care can be done by unlicensed staff. And it's a little confusing because our nursing facility level of care, people, if they reside in a nursing facility, and you could say this about all the waivers, people would get all of their care through that residential nursing facility, medical, doctor, any kind of care. When it's waiver care, people get their needs met for health through a separate provider. Like I would go to a doctor if I was sick or I needed surgery. I wouldn't get that through my assisted living home. So I have the same kind of care, but the waiver only covers the community-based care. Okay. It's just a little different than residing in a separate place. All right, next slide, please. Kind of what this slide says, a person choosing the waiver will have blended supports as needed. Waiver supports, a medical professional, other licensed care like maybe behavioral health. They'll have family, school, work, or community to support them, all moving towards living a life I choose with the supports I direct. And so the next slide, please. There are 2 kinds of services. One of them is called habilitative, which is for teaching skills of independence in everyday life. And the other is called non-habilitative, which simply provides care. They both are great services. Habilitative services can be done by someone who is also providing care, but they're also teaching a person to do skills on a daily basis. It's a little different. The services are specific to certain waivers, and not all of the services are available to all of the waivers. Next slide, please. So how are people eligible for these waivers? Different kinds. All right, next slide after that. Okay, awesome. So we'll talk a little bit about intellectual developmental disabilities waiver and individualized supports waiver eligibility. Briefly, and then Heather, you join me. A person with an intellectual developmental disability has to have Medicaid, need a diagnosis by a qualified professional. A person would have one of these 5 diagnoses listed: autism, cerebral palsy, IDD, seizure disorder, or an other condition that causes IDD. This would have occurred before age 22, has a lifelong impact on 3 or more major life functions. They do have an assessment with SDS staff doing that. And the assessment is called the ICAP Inventory for Client and Agency Planning. We'll go to the next slide. And then Heather, we'll talk a little bit more about that.
Hi. So as Kara said, there are 2 waiver options for people who have intellectual and developmental disabilities, the IDD waiver and the ISW waiver. The steps and requirements are the same for each waiver, but the main difference is that the ISW waiver, the individualized supports waiver, has a cost limit to it. So a majority of the services that we'll talk about in a little bit are available on the individualized supports waiver, with the exception of some of our 24-hour services like group home and family home habilitation. And we have a slide in a little bit where we'll lay that out for you as well. But it's important as we talk about sort of the process for accessing one of these 2 waivers to remember that it's the same for the 2. The difference is at the point where a person chooses what services they'd like to have included on their support plan. So this is a handy dandy little infographic. I realize that it's very small and you probably can't see it. On the next slide, I have included some links to access the website that includes this slide. So you'll have that in the slide deck so you can go and take a look at it later. And I'm happy to provide my information. If anyone wants it, I can send it right to you. But it is handy and it takes a person through the entire process from working with an aging and disability resource center all the way to the approval of services. And so to access one of these 2 waivers, a person might start the process with an ADRC, or they might go straight to a developmental disability resource connection representative, a DDRC. And the very first step is that they need to complete a developmental disability eligibility application. So that's the entry door to access the 2 waivers. So the individual and their family works with the DDRC representative to gather any needed documentation, to fill out the eligibility application, and then the DDRC representative submits that directly to Senior and Disability Services. They actually have access to our database, so they're able to go in and complete that form in our system, and then it gets put in a queue so that we know that we need to work that form. Families can fill out the application themselves. Care coordinators could if they wanted to, but we really encourage families to work with DDRC representatives because we work with them directly to train them and ensure that they are providing, the same level of support, applying the same criteria, et cetera. So once SDS receives that application, if we make a determination that a person has met DD eligibility, we'll let the individual know that, and we'll let them know whether or not the DD eligibility is indefinite for the lifetime or if it's time limited. And then we'll inform the individual that the next step, if you want to be considered for one of these two waivers, is to submit what's called the DDRR form, a developmental disability registration and review form. So the person is still working with the DDRC representative to complete that form and get that submitted to Senior Disability Services. And now we're on step, let's see, 6. So an individual gets their name added to the registry, and depending on the type of waiver that they're interested in, their DDRR form will either be scored if they're interested in the full intellectual and developmental disabilities waiver, or if they're just interested in the ISW waiver, their name just gets added to the registry. And then we draw individuals based on the resources that are available. We manage to a certain number. So in our approved application with CMS, we say for the individualized supports waiver, we can serve 600 people. And then for the IDD waiver, we can serve, it changes every fiscal year, but I think we're at 2,030 for this fiscal year. So we manage to that number. So as people, as there's attrition off of those waivers, we can draw more individuals and put them on the program. So once someone is drawn for the program, we send the family what's called a notice to proceed letter. And then they would start the process of finding a care coordinator and submitting an application to be assessed using the ICAP. And that's the tool that SDS uses to determine whether or not someone meets the intermediate care facility level of care. Once we determine that an individual meets that level of care, they can work with a care coordinator to submit their support plan and request the services that they'd like to have. It's a very complicated process, as you can tell from me going over these steps, which is why the best resource that we can give to people if they are just at the very beginning stages is to work with a DDRC representative in their community. On our website, we do have a roster that lists all of the DDRC representatives in the state of Alaska and what region they serve. And so that's the best resource you can direct someone to sort of start the process. And those DDRC representatives can look in the system once they have access and see where the person is at in the process and help direct them where to go or what the next step is. Oh, next slide. And then in terms of changes to the program, just for folks to be aware, the registry or the wait list as it's referred to for ISW is new. It's new as of the start of this fiscal year, so July 1st, 2023. The ISW program was started in 2018, and it's taken us almost 5 full fiscal years to get to that capacity of 600 people. So now that we're at that capacity, our requirement is that we implement a registry. We have certain requirements that we have to meet in terms of providing an annual report to the legislature. Anytime we have a wait list, we have to do that. So this fiscal year, at the end of this fiscal year, June 30th, 2024, we'll have to start providing that report for the ISW registry. So there is one main difference between the ISW registry and the IDD registry, which I mentioned before, but I'll mention again. If someone is just interested in the ISW program, so the smaller program that has the cost limit, they don't have to fill out an entire DDRR form where they provide information on any kind of caregiver concerns or housing issues. It's a lot of information that we ask for. And we're not requiring that if someone is just interested in ISW. And for the ISW program, we'll be drawing based on time that someone's been waiting for the program versus the IDD program. For that registry, we're drawing based on the person's score that they receive from that DDRR form that they fill out. So it's a distinction that is important to note. We do still require that people submit the DDRR form annually, just so we can ensure that we have an active list that represents who's actually waiting for services and to ensure that we have up-to-date contact information. And then, like I mentioned, I have a couple of links here. So the first one is just the link to our main IDD webpage. And that has a ton of information. So it has the DD eligibility application, what the DDRR form looks like. It has the infographic that I showed you on the previous slide. It has contact information. It's a wealth of information for you. So a good resource. And then the second link is just if people are interested to see those annual reports that we provide to the legislature, you can access those at that link. And that will tell you everything you ever wanted to know about who's on the registry, and not their names, of course, but who lives in the northwest part of the state, and of how many people are in this age group. And it has a lot of information about essentially the demographic makeup of who's on the registry, how long they've been waiting, and that sort of thing. Okay. Can't remember what's next. You want me to talk about this one?
That's good.
Okay.
Do you want to? You can.
I
Yeah,
can.
yeah, probably better.
So next slide. Oh, next slide.
Next slide, please.
So, next one, yeah. Yep, perfect. So I realize it's challenging to kind of think about the sequencing of all of this, and I've been at it 10 years and longer before when I was working in the field, and I'm still, trying to make sure that when I present it very clearly, because there's really three main steps. That's the best way that I can remember it and probably share it, is that the first step is eligibility. The second step is the registry. And then the third step is the actual application, the level of care application. So at the point that we have drawn someone off the registry and we've sent them a letter that says, you can now proceed, you can select a care coordinator, you can let us know who that care coordinator is, and then you can submit the application for us to assess you. Once we get that back from the individual, like I mentioned, we do a functional assessment. It's called the ICAP. It's the Inventory for Client and Agency Planning. It's a 4-page document. We go through 4 different areas, and we talk with 3 people who the individual or their guardian have identified as knowing the person well. So we'll ask questions like, does the individual alternate their feet when they go up the stairs? Are they able to cut a straight line with scissors? So it really is items that are looking at what a person's functional abilities are day to day, not their highest level of functioning or their lowest level, but day to day, what are they able to do? We take the information from those 3 individuals, we call them respondents, and we provide an aggregate score based on the 3 responses that we've received. And then that information is put into essentially a CompuScore, into a system that shoots out a score that determines whether or not a person meets an intermediate care facility level of care based on their age in years and months. I'll let you take it. Okay.
Awesome. Thank you, Heather. Thank you. All right, so we'll go through a little bit about the other type of eligibility, and then nursing facility level of care. And then we'll talk about the services, and I'm hoping to leave some time for Q&A at the end as well. So this slide is talking about our ALI, Alaskans Living Independently waiver. So this is the rest of our waivers. We'll talk about nursing facility level of care. For ALI, I have to be 21 or older, have Medicaid. I have to visit with or consult with our Aging and Disability Resource Center for an intake, a person-centered intake, a little interview, if you will. I have to have a physical disability with medical documentation about that. I get an assessment, and it is essentially a functional assessment called the CAT, Consumer Assessment Tool. It tells my strengths and needs for support in everyday life based on my ability to move and do and to care for myself in the home and community. And then the result of that CAT shows the need for care the same as that would be given in a nursing facility if I'm going to take advantage of that waiver. Next slide, please. Let's see.
Back one.
Go back one, I think, or back 2. back one more, back one more. There you go. All right. For adults with physical and developmental disabilities, I may have a physical disability and a developmental disability. So there's this waiver for me. If I'm age 21 or over, I have Medicaid. I have a physical disability with medical documentation. I need to be on the DD registry like Heather talked about. I need to have that CAT assessment. And that is when a nurse assessor will come out from Senior and Disability Services, or in some cases do a Zoom session with me for at least for my first assessment. And then it shows the same need for care as what is given in a nursing facility. Okay, next slide. Oh, yeah, add.
I just wanted to make one clarification for this one. For the APDD waiver, an individual has to have been found DD eligible. They don't have to be on the registry if they're not interested in pursuing the ISW or the IDD waiver, but they had to have had that eligibility determination, or it needs to be made before they can continue with the process.
Gotcha.
Yeah.
Good to know. So you still do the things that Heather talked about as the first few steps, but you may not end up wanting, to be on that registry for the other waiver types. Good to know. Okay, next slide. All right, this is for our CCMC, children with complex medical conditions. This is for our young people birth to the last day of their 21st year, of course, have Medicaid, needing to have an intake with our Aging and Disability Resource Center, have a physical disability with that medical documentation. This is for young people who are medically fragile. This means that the person would spend 30 or more days in the hospital per year. Doesn't have to be continuous, but generally per year, 30 or more days. This person will need frequent life-saving treatment and be dependent on medical technology for daily life. There is a CAT assessment tool for children that we use to determine this need. And it's the same need for care as that given in a nursing facility. Okay, next slide. Okay, so what do waiver services do? Let's go to the next slide, please. Our habilitative services. What I've done here is listed the service and who it's for. In-home supports is for a child learning daily living skills at home. Supported living is for an adult learning daily living skills at home. Dehabilitation, if I am age 3 and up and I'm going to be learning community interaction skills in the community, that service will work for me. Employment services, I need to be work age and I'm going to be learning work skills. Residential group home, this is for an adult. A person living in a licensed home in the community, licensed assisted living home with my peers, with some peers, learning skills for living at home and in the community. Residential family habilitation home I could be a child or an adult. I could live with a foster family, learning skills to be at home and in my community, to be more dependent. Intensive active treatment. This is a service done by a licensed professional, and it is specific therapy needed by that person, provided by that professional. Next slide. Our non-habilitative services are services that aren't about skill building, although it all supports that. Care coordination. A person needs this professional to write and amend their support plan, to meet with teams and help advocate. Respite is available to any age and where I have an unpaid caregiver, a main person taking care of me. That person needs a break. So I might have respite in my waiver for that person to get a break. Specialized private duty nursing. A person needs a nurse to provide skilled care at home, ongoing, everyday life, not in the situations where people are sick or there's other more elevated care needs going on. Nursing oversight and care management. This is for medically fragile child or an adult with the IDD waiver who would need a nurse to oversee their support plan around the medical needs and to help solve problems that are that come up with complex needs like that. And meals, this is for an adult who would need up to 2 meals a day, either delivered out to home or perhaps going to a center to eat the meal in that setting. Groups, kind of like a senior center, sometimes you'll see that they have meals. Okay, more non-habilitative services on the next slide, please. Transportation, this is for adults. They need a ride to or from community places. Environmental modifications. This is for an adult, or it could be for children as well. Home living space modified for access. You could be for your own home or a rental home with permission. Specialized medical equipment. A person needs an item that increases daily life independence. There's a list of approved items. Couple examples would be, you know, if I drive a car, but I don't use my feet to drive, I need all the controls to be done by hand. So a car could be modified so that I could drive it using just my hands. Or maybe I need a recliner chair that lifts me up when I need to get out of it. That's another piece of equipment like that. And there's a certain list that people choose from, and a care coordinator would give me that list and talk about it with me. Residential supported living home. Yeah, this is for an adult who needs daily help in the assisted living home. Adult day service. This is for an adult who needs activities with peers at a community center. Something interesting to do with my peers, keep me fresh and active during each day that I choose to go. Okay, so next slide. Which services are available in which waiver? Next slide, please. In our intellectual developmental disabilities, a la IDD, in-home supports, supported living, day habilitation, employment services, residential group home, residential family home, home, intensive active treatment. Next slide. Care coordination, respite, specialized private duty nursing oversight and care management for an adult who's medically fragile, transportation, environmental modifications. And again, like I said in the beginning, they can't overlap or duplicate each other. So that's just a list. A care coordinator would put a plan together to make it make sense for each person. Next one, next slide. Oh, that's it. Okay. Annual budget. Okay. Got it. Individualized supports waiver. This is a waiver that does have the budget limit. Right now it's $24,205 for services in the plan. If a person needed up to $5,000 more for safeguard services, but there is we call safeguard funding available for that. Care coordination is not counted in that limit, and it does have this list of supports available, and this would be up to the person to choose and work out with their care coordinator what they needed in their plan. In-home supports, supported living, day hab, employment services, respite, transportation, and intensive active treatment. As you can see, it does not include out-of-home residential services because the budget isn't high enough for that, but it does meet a lot of people's needs. And then the next one, next slide. Adults with physical and developmental disabilities choices. This is actually all of the services might potentially be available to this person. All of the services that are in the list. All right. Next slide, please. Adults, Alaskans living independently. Care coordination, respite, transportation, environmental modifications, specialized private duty nursing, residential supported living home, adult day, specialized medical equipment, and meals. Okay, next slide. And children with complex medical conditions. Again, this is another more comprehensive list, including all the services, because if a person, remember it was for age birth through the last day of their 21st year. If I'm an adult between 18 and the last day of my 21st year, I could choose some of the adult services. So that's why that's another one where the services are all potentially available. Next slide. There's other kinds of help for daily living. Next slide. We have our community first choice option. A person would need the same level of care for any of the waivers. It's also available for people who are under 22 or over 65. If they have a diagnosis that would bring them into IMD level of care, which is Institution for Mental Disease level of care. You can have both a waiver and CFC services or just one. And of course, you have to have Medicaid. So care coordination, personal care services, chore, personal emergency response system, which is, like a button that you might wear to push if you can't summon help on a phone or something like that. Supervision and queuing and reminders for people who just need somebody there to remind them to do something. And then skill building for activities of daily living, which is like bathing, eating, dressing, things you do every day to take care of yourself at home. And next slide. Not a waiver, but available personal care services. This is hands-on help at home or place of work for activities of daily living and instrumental activities. Instrumental activities are laundry, shopping, preparing a meal, things like that. Activities of daily living are bathing, eating, dressing. You don't have to have a facility level of care to take advantage of personal care services. You do have to have Medicaid and an assessment of physical ability to tell where your needs for support are. But that's also another direct service that's available, set of services that's available. Okay, so my next slide just says thank you on it. That's the end of that presentation. I know we had a little bit of a question about, or we had some a request to talk about things that are work in progress, updates and things like that. I can give you a few, and then we'll probably have a couple minutes here for at least a couple of questions. We have a lot going on, right? We have a lot of different options coming. Briefly, we have new services that are being thought about right now and planned out. And of course, with state services, you'll always see that there's a certain process. We like to do education of stakeholders, like people who might be affected by it or interested in it. Any Alaskan could participate. So recently we introduced Adult Host Home, which is a new service, which would be a home to care for an adult experiencing disability. We sort of haven't formed it all out yet. It's just basically that. We're just asking for ideas around that. Probably a relatively simple service that could help. The idea of it is to help people who are maybe being cared for by family members right now, but they're in the process towards other more intensive services, something like that. So we have Adult Host Home, we have Specialized Group Home and Specialized Family Hab Home. These proposed homes or services in a home are meant to help people who have complex needs for care, who need a lot of support, people who are experiencing a time in life where maybe they're having a lot of challenges, or they might pose a danger to themselves and others for whatever's going on with that person. A lot of elevated need for care for that person. So those are some new services that we're engaging with Alaskans about. We do have some flexibilities that arose through COVID, the public health emergency. Some of our flexibilities are ending and some of our flexibilities are continuing. Briefly, continuing ones are care coordinator can do a care coordinator visit can be done. They have to do a face-to-face visit, but we can contact people through the not teleconference, but virtually with video chat, things like that. A couple of the other services, up to a certain percentage of them, could be done through video conference. And we have legally responsible individuals being able to be paid to provide services, which we did allow during the public health emergency. So that means a guardian, or legally responsible individual can continue to provide certain services for people past the end of the public health emergency. We have a lot of frequently asked questions documents that we've been working on to help make it more clear to people about the changes. And I don't know that I could propose to summarize all of that right now. But best thing that we can do is to stay connected with senior disability services. Maybe think about signing up for our e-alerts or something like that. You can always email us at sdstraining@alaska.gov. That's our training unit. Myself or one of our training team will answer you. Any question at all. We love questions from individuals and families too, because we are that. Okay. A question.
There's also another one that we had talked to the board about, is about the HA, which stands for, it stands for, architect, building. That's what it's called. And it's starting with disability and parking and handicap parking and talk about national park, refuges, and we had talked to different things about people with disabilities. And so we worked really hard on getting talking about the Americans with Disability Act and with the Architect Building Act. And that's concerning with a building process for people with disabilities, with people who are in wheelchairs, who have blind and who can't be able to see and all that.
Awesome. Thank you. Great topics. Go ahead.
For a long time. My question is, with that DD registry, once you get on that song. Okay, can you hear me? Once you get on that DD registry and you're placed on that wait list, I know back in the years, there used to be an extenuating long wait list and time. Is that still the case?
Okay, first remind me your name because you look
Oh,
so familiar.
Rini Pipkin. I'm from Soldotna and I used to run
was
Clarity Care Coordination.
Rini.
Rini Pipkin.
Okay, okay. Well, good to see you. So a couple of years ago, we spent a lot of effort to clean up the registry. We had quite a few individuals who hadn't submitted a DDRR form in over 3 years or more. And so in that fiscal year, we did reduce the registry from about 800 individuals to around 400 individuals. So that's one thing. We also changed our waiver with CMS, where we used to have language that we would only draw 50 people a year for the IDD waiver, but we realized that attrition was a little bit higher. We had about 70 people a year who came off of that program. And so we changed the language to say, we're not going to just draw 50, we're going to manage to this number. So that allowed us to draw more individuals. In the last 2 or 3 fiscal years, we were able to draw over 100 people for IDD alone, those 2 years. So there is about 400 or so people that are waiting for, let's just say, IDD and ISW combined. But I have seen that we're able to draw individuals with less critical needs because we've had that ability to draw more people. And we hope that the benefit of drawing people for ISW based on the length of time will offer individuals who have been waiting a long time, but maybe don't have very critical need to get those services in place quicker and hopefully not get to the point of, having very critical needs. So The average length of time, to directly answer your question, is about 4.5 years. I haven't gone back to see if that's changed. My gut tells me it hasn't changed that much. But my hope is that moving forward, being able to draw people for ISW based on time, that we will see that average go down because people will have their needs met and maybe not need to wait for the more comprehensive waiver. Great question.
I think we might be at time. I'll let Joanna. Are we at time? Are folks submitting online? Maybe one question from online just to get one like that?
Fair.
Maybe not. It's okay.
It's a lot.
That's a lot. I know. Okay, no questions online. I'll take one more from here. Anybody? All right. Well, awesome. Thank you so much for listening to us and being part of our conversation. You can always email me and my team at sdstraining@alaska.gov. Please send us any questions. I definitely welcome questions from people and families. Being a family myself, I've been through a couple eligibility processes. I've been through a couple ICAPs, a few here and there. So don't hesitate to reach out. We do have some other things we're doing right now. We're doing our office hours for our provider types. Each week we have 1 hour open Zoom for people to come in and ask questions. We also have a family Zoom that we're doing once per quarter, and a few more educational opportunities for individuals and families about eligibility and things like that. So always happy.
About those up on
okay, great. Yeah, there's some printouts up on the table. I think the second one in up here to my left. Wave. That's our colleague Cassandra Lynch. Thank you. Question? Did you have a question? All are welcome. Okay, thanks everybody. Have a great rest of the conference. Kara, K-A-R-A.
All right, everyone, we will take a short break. If you want to go back upstairs and network with some of our vendors or network amongst yourselves, we will be back at 2:30 for the Working on the Workforce presentation and roundtable discussion.